It's always our pleasure to welcome our recently newfound expert. He's been on the show probably a half a dozen times already. Paul Siegert. He is a managing partner of PCS Advisers. And what they do and what he does is they are changing the way businesses manage their second largest expense. Bottom line, it's health care, employee health care. The employers get a ginormous bill and the employees get substandard care. And he's changing that and teaching companies how to change that at PCS Advisers. Paul, welcome back to the show.
Thank you for having me.
Well, thank you for being with us. First of all, I just want to give you, I always call him a shameless plug. What do people have to do to get your advice and services?
Well, they can go to our website, PCSadvisers.com. We spell it with an E-R-S, not an O-R-S, and reach us there, and we're happy to help anything related to healthcare and how you pay for it. That's what we're involved in.
And where are you located?
California and Tennessee.
Oh, good. I can hear a little bit of an accent. Is that from being from Southern California or Tennessee?
Yeah, right. Well, my family's actually from Santa Barbara, but
oh, wow.
My parents ended up getting a ranch in Northern California. That's where I grew up, and then I kind of recently, because of tax laws and a bunch of other things, got a place in Nashville. So,
well, good for you.
It might be wearing off.
I think there's a lot of California plates out there, from what I understand.
There are.
So you have are going to give us a perfect example of what is wrong with how people pay for the services they get. And this was an example of somebody that had to go get a PCR test and an antigen test. And go ahead and tell us the story.
Yeah, there was a consumer in Texas who wanted to get a COVID test. They went, and this was, part of the CARES Act was that consumers would not be paying out of pocket for services related to COVID. That would include testing. It would also include, other care related to COVID. Not so much our topic today, but in this case, this gentleman went to an independent ER, kind of freestanding ER. There's a chain of those in Texas by this particular company. It was out of network for his insurance company. And so based on the way they wrote that CARES Act, it put the provider in a position where they could charge virtually whatever they wanted. So then there were two tests performed on him. One was an antigen test, which is the less expensive, quicker results, not quite as accurate COVID test. If you or I or anyone listening was to buy that test, we could get that test for about $20. And then he also was given a PCR test, which is a little more precise and maybe a little longer to turn around. That one you and I could get for about $120. And they billed his health plan $56,000.
$56,000.
It almost sounds like you really can't make this stuff up.
You can't make this stuff up. It's like a $30 aspirin in a hospital.
Yeah. And it's
so
off track.
This brings up a point that what we used to call this, for lack of a better word, is the skin in the game principle.
Right, exactly.
And I learned this the hard way myself. Now, I learned this in my 20s. So what happened is when you have virtually no deductible and virtually no out-of-pocket expense, and you go into a doctor and he says, oh, I want to do this test and that test and this procedure and that procedure. And you may say, well, doc, do you think I really need it? And he goes, I think it'd be a good idea. If you ain't paying for it, you will never ask how much it costs. You'll never ask because you don't care, because you don't think you have to pay.
Right.
But in reality, you do. And why don't you explain that, Paul?
Exactly. It makes this story, I think, even more interesting because this consumer was held harmless from any out-of-pocket costs by the CARES Act. And that opened up an opportunity in the eyes of this provider and, unfortunately, many providers around the country to pile on and bill disgusting amounts with ridiculous amounts of profit and profiteering, you'd have to say, and thinking, and their thought was, who will complain? They don't have to pay anything out of pocket anyway. They'll just figure the insurance company is going to have to pay it. This consumer saw the bill arrive, and you get that explanation of benefits in the mail after you get a healthcare service that shows here's what the gross charge was, here's what the adjudicated charge was, or the what was paid after your discount. And in this case, after discount was applied, because it was out of network and some other factors, the insurer paid $16,000. So still, I mean, a ridiculous upcharge on this procedure. And that upset this consumer because he realized that while it was free for him today, that's the reason we have these unmanageable increases in premium every year, because we've created this healthcare system where we've taken the skin in the game out of it, or we've put the skin in the game in such a way with copays and deductibles that they don't even actually have any relation to the cost of care. And so people are consuming. We have this very powerful force, the American consumer. Everybody that makes any product in the world wants to get it here. But we've really disabled them because you don't know what things cost. You only know what you pay, your copay, your deductible, and it has no relation to the cost of care. So it allows, behind the curtain of the insurance payment model, it allows for misbehaviors of all sorts. And the thing about COVID is it's put a spotlight on something that is part of our system. It's a flaw, and it's been here. And this kind of thing that we're seeing with this COVID test is happening literally millions of times a day. And we are all paying for that.
Right. So here's one of the big questions in this story. The insurance company paid, but because this guy did what was right and complained, the insurance company claimed that, well, it was a billing error rate. We missed it. And they're going to go back and correct it. So to what degree do insurance companies really monitor this dutifully and vigilantly to keep their own costs down?
This is a great question. And it's almost like we rehearsed before the call, but we didn't.
Well, you know what? I'm going to do a cliffhanger and have you answer when we get back from our break. All right. Our guest, PCS Advisers, Paul Siegert, managing partner, listening to the Andy Caldwell Show. Stay tuned. To welcome you back to the show, my guest, Paul Siegert, managing partner of PCS Advisers. If you're an employer and you want lower healthcare costs, contact them. If you're an employee and you want to get a better plan at your place of work, ask your boss to contact them. PCSadvisors.com. What we're talking about today is some poor fellow went to get a PCR test. It should cost $120. They billed him his insurance $56,000, and the dopes at the insurance company paid $16,000. My question before the break, Paul Siegert, do insurance companies have an incentive to look for errors and overcharges like this?
Well, the sad reality is, since we passed the Affordable Care Act, we changed the rules on insurers. There's a thing called the medical loss ratio that was a part of that. And we told these health insurers they got to keep 15 cents on every dollar so long as they spent 85 cents of it on a claim. The unintended consequence of that was that they do better when claims costs go up. And so the rate or the percentage of the claims that they auto-adjudicate, that they auto-approve, and they just have computers approve essentially and don't even have humans look at, went way up after that happened. And it's now virtually all claims are getting auto-adjudicated. And so the answer is no, they don't. They do better when claims costs go up, unfortunately. They're simply in a debit accounting position where if the costs run high, they give you a bigger increase the next year. And so it's not like other forms of insurance. It's almost tough to call it insurance in the traditional sense. It's not like your car insurer where they really don't want you to get in an accident. They prefer you did not have a loss. That's not the case, unfortunately, with the way that we've designed our current health insurance system.
Well, I'll give you an analogy here. I actually like the utility franchise model that we have, but one of the flaws in it, one of the reasons the utilities did not fight green energy, which is super expensive and delivers very little in terms of reliable supply, let alone base load, is it doesn't matter how much it cost because they had a built-in profit margin. So if the state of California told them you have to have X% of green energy in your energy portfolio, no problem. We'll go buy it no matter what it costs because the consumers will pay the cost and we get that much more profit. Having said that, let me ask you kind of an ancillary question. We know that hospitals, if somebody came in as a victim of a car accident and they died, they test them for COVID, they were COVID positive, they got to mark down died with or from COVID, they got reimbursed. To what degree was the government also involved and behind this, that all things COVID, it's like, sure, we'll pay? Paul, are you there? Jordan, do we still have him?
Hear me?
Paul?
How are we doing now?
Good. Okay. Did you drop for a minute?
I'm not sure what happened there.
I don't think it was me this time. Did you hear my question about to what degree was the government involved in paying for any and all things COVID related?
Yeah, really, not as much as you would think. There was some monies that were given to hospitals, but when it came to the consumer, they were held harmless largely voluntarily by the insurance companies. So if they got hospitalized from COVID, insurers came out and kind of in unison for the most part and said early on in this process, we're going to waive people's out-of-pocket costs for COVID. Now, as I go through renewals with employers, they're saying, hey, all those charges for COVID, those won't affect us, right? Well, unfortunately, they will. They were simply volunteering the plan's money to cover those costs and saying those employees wouldn't have out-of-pocket costs in a lot of cases. So it didn't, it wasn't necessarily that they were funding it so much. They did come through and give money to the hospitals to kind of account for the fact that they were keeping other patients away from these hospitals. And that was a big boon for lots of hospitals. But the insurers in the end and the health plans that are really run by these employers around our country were still on the hook for these expenses.
So here's another question. We're not seeing a lot of these stories, but we're seeing enough of them to make you shudder. And that is saying, okay, if you've got COVID, but you didn't get the vaccination, we're not covering you.
what we're seeing there isn't so much that the insurance companies won't cover it, but there are providers. There was a case, I believe, in Colorado where a lady needed a kidney transplant, and they declined to give her the transplant because she was not vaccinated, and their justification was there's a 20% increase in her potential morbidity from the transplant procedure because she did not have a COVID vaccine. Now, here we are in the midst of the pandemic. I think they would be hard-pressed to produce a study of any kind that was reliable enough to say that with certainty. But in any case, that was their justification. And what's crazy to me, the insurance would have paid for it. The provider in the hospital said, we're not going to do it, and which put this person's life absolutely at risk. And yet they will, the very same day, perform surgeries on people who are morbidly obese, who have a much higher increased morbidity for any surgeries. The morbidity rate for someone who's obese is twice the rest of the population, not a mere 20% increase, which I think would be tough to prove. And so it's a very interesting, arbitrary line to draw when you look at numbers, the healthcare numbers every day like I do, and you see that 86% of what we all spend on health insurance premiums and health care essentially pays for chronic illnesses that are for the most part the result of or related to obesity and lifestyle decisions that people make. It's incredible.
So let me rephrase my question, and thank you for that. A follow-up question. My question was, and I think I've seen news stories on this, that if somebody did not get vaccinated, but they get COVID, that the insurers are saying we're not going to pay for your COVID care. Have you seen that, or am I mistaken?
Yeah, I don't believe that that's happening. We do have some providers that are refusing treatment for people who are unvaccinated, but the insurers are still going to pay.
Okay, so it's the providers that, not the insurance companies.
Right.
Okay.
But we do have employers running health insurance plans that are saying, we are going to charge you more in payroll deduction or more for your premium if you choose to be unvaccinated. And then Oxner Health in Louisiana even went to the step to say, which is the most extreme we've seen, if your spouse is unvaccinated, we're going to charge you or fine you, I would have to say, $200 a month in your health insurance premium. Their justification was they've spent $9 million on COVID care in their health plan. And when you look at the overall numbers, and that's part of the story, but to me, it's a very incomplete story unless you throw in a few more numbers. Here's a couple of them. In the last 2 years before COVID hit, they're a nonprofit, so you wouldn't necessarily call it profits in their accounting system, but they were left over with about $70 million each year, the 2 years leading up to COVID. In COVID, because of CARES Act money from the government and other things, they were in the mid 600 millions in leftover dollars at the end of the year. So the best year perhaps that they've ever had. And then their health plan, which serves 11,000 people and is almost certainly well over $100 million in annual spend, had a reduction in claims if they performed like most of the country of about 70%. So they picked up $70 million there. And then they're using this $9 million COVID care expense as an excuse to fine employees for spouses that are unvaccinated. It's a really incredible cover that they're using COVID for to take that step.
What a racket. Paul Siegert, thank you so much for being on the show. We love having you on as our healthcare expert. And again, folks, if you want to find out how you can lower your healthcare cost and improve your healthcare, go to PCSadvisers.com. Paul, thank you for being with us.